Should we get started?
Okay.
Today I wanted to take just a few minutes with you guys to talk a little bit about non-surgical treatments, Botox and fillers. It's a really important part of our practice. Stoker Aesthetics is a place where we highlight a lot of these details on our Instagram. Botox, of course, is probably the best known of all these treatments, and it's really good for blocking muscle contraction. So in the forehead here, the way it can wrinkle, the way that crow's feet can show out here on the sides, the way that frown lines can form right here. It's very effective at treating those areas. Dysport is a competitor and also a very good treatment. It's really important to get started early with Botox or Dysport because you don't ever want to develop wrinkles to begin with. I think of wrinkles as both active and static. Static wrinkles are ones that are there permanently. It's from years of doing the same type of wrinkling, and it's what you see on older people in general. Dynamic wrinkles are the ones that you can show up if you animate and really squeeze your muscles together. We call the phenomenon pre-juvenation as opposed to rejuvenation. Pre-juvenation is when patients get started proactively to slow down the aging process. Even our employees in our practice who are in their 20s will frequently use Botox and Dysport because they never want to progress to that next level where they require more advanced treatments with more downtime to eliminate those static wrinkles. Another really important group of treatments that you may be familiar with are fillers. Fillers have exploded in popularity in the last couple of decades. There are now dozens of different options from several different manufacturers to meet a whole variety of patient needs. In general, differences between the products include how long the product lasts, how thick the product is. For instance, if you're using a product just under the eyes here where the skin is very thin, or in the lips, you're going to want something that's more liquidy, more viscous. If it's thick, you might see it or feel it. If you're plumping up the cheeks, though, or in the temples here on the sides, we typically inject those into a deeper plane where you just don't feel it as much. Just like the bone here, you don't feel as much because it's covered with a layer of fat and skin. So there's how long the product will last and how thick the product will last. A third important concept is what is the product made of? Hyaluronic acid is a molecule that is a component of skin in all of our bodies. That is also a fundamental molecule that's used in a lot of the current injectable fillers. There's an important margin of safety with hyaluronic acid because there is a chemical medication called Hyaluronidase. That's an enzyme that immediately dissolves hyaluronic acid. So if a patient were to have a filler treatment that they don't like, it's not frequent, but it is possible. It is not difficult to dissolve that filler in a hurry immediately before their eyes. Also, if there's a rare reaction to an injectable filler where somebody has an intravascular injection, it looks like some of the skin is bruising and might be very unhealthy for that skin. The injector will recognize that and is able to inject Hyaluronidase in there and dissolve that and usually solve that problem for the patient. If you did the similar type of injection with something such as fat grafting, which has its own uses, but it isn't as safe in that regard because number one, you can't just melt it away and undo it if you're unhappy with it. And if there was ever an emergency where you really wanted to, if there was, for instance, an intravascular injection, it would be unlikely that you would be able to solve that problem with fat grafting. Other products such as, let's say, a Radiesse, which has some benefits, but it's not made of hyaluronic acid. It's a longer lasting injectable, but it doesn't have that extra margin of safety of the hyaluronic acid. So in my mind, typically the hyaluronic acid based treatments are most popular. Almost everybody can benefit from them to some degree, but it's also really important to know when to stop. So the common areas that we treat are under the eyes with filler, in the cheeks, in the lips, in marionette lines, in the nasolabial folds, and in the temples on the sides. Also for building out a stronger jawline. It's a very common and very powerful way to use these fillers. Another nice thing about fillers is that it's not an all or nothing phenomenon. For instance, decades ago, the only option we had for augmenting the cheeks was really cheek implants. Those are permanent, typically done intraoral or through facelift incisions, but there were a lot of problems with them. For one, it was all or nothing, so it would be a pretty dramatic shift for patients. Secondly, they weren't very precise. It was, I'd say, fairly common for the cheek implants to shift a little bit or to rotate a little bit, and that's a difficult problem to deal with. Plus, it's a larger foreign body, so potentially there would be more problems with things such as infection or fluid collections. For all of those reasons, cheek implants are much, much less common than they used to be, because now we have something that's easy and quick off the shelf to use called injectable fillers. Another benefit of injectable fillers as opposed to fat is that it doesn't require a donor site. It's one thing if you're already doing liposuction on somebody, but it's quite another if you're just in a clinic visit. You can just take something off the shelf. It's very predictable, very precise. You can reverse it if you don't like it. In my mind, that's much more desirable than taking somebody into the operating room to harvest fat from them to accomplish a similar thing. So that's really a quick overview of Botox and Dysports, which we refer to as toxins, as well as the popular injectable fillers that we use today. And I guess on that note, are there any questions you guys I can answer for you? Let's see if there's anything coming in. Let's see. So that's it. All right.
What's the new Instagram account? And what are you going to be posting on there?
Yeah, I guess one thing, just in case you think of, you want to check out some examples later, we have a new account, Stoker Aesthetics, that we're using to highlight these types of treatments. It's on Instagram. I encourage you to check it out. We're going to put a lot of effort into it, and I think it's going to be a good source of information going forward.